Doctor, what's wrong with me? I've lost all this weight, even though I'm always hungry, and I'm so thirsty I basically live in the bathroom.
Let me take a blood sample to evaluate your blood glucose levels. So I got your test results back, and it looks like you have diabetes mellitus, also known as type 1 diabetes.
What is type 1 diabetes?
In a healthy body, when your glucose levels rise, the insulin-secreting cells of the pancreas, the beta cells, secrete insulin into the blood. Insulin causes most body cells to take up more glucose, and the liver to take up glucose and store it as glycogen. This reduces the glucose in the bloodstream and returns it to homeostasis.
But in your body, this negative feedback loop doesn't happen.
Type 1 diabetes is caused by an autoimmune destruction of the insulin-producing beta cells in the pancreas by the T lymphocytes in your immune system. Eventually, not only all of your beta cells but also your pancreas are destroyed, and your body can no longer produce insulin naturally.
Insulin is a protein that facilitates the entry of glucose into body cells. In many tissues like muscle, the major transporter used in the uptake of glucose is called the GLUT4 transporter. This transporter shows up in the cell membrane as a result of insulin acting on the cell. Normally, GLUT4 transporter proteins are present in vesicles inside the cell. The binding of insulin to the insulin receptors in the cell membrane lead to the fusion of these vesicles with the cell membrane. This basically inserts the GLUT4 transporter protein into the cell membrane and gives the cell the ability to absorb glucose. When insulin levels are too low in the blood, insulin receptors aren't occupied, as they can't take up insulin that isn't there. If the cell isn't stimulated to fuse the GLUT4 proteins to the cell membrane, the cell can't take in any glucose.
But why does this happen?
The causes are a combination of genetics and environmental factors. Specific genes have been connected to the development of diabetes type 1, the MHC genes, class 2, specifically genes DQ and DR. Environmental modifiers include infectious agents like viruses, early life factors such as vitamin D deficiency, and stress and other climatic influences.
What does having diabetes mean for the health of my child?
There is no cure, but it can be managed. She'll just be insulin dependent for the rest of her life. Diet control can also help a lot with this disorder.
It is important for diabetics to follow a treatment plan. This plan includes taking insulin every day. Which insulin you take depends on your discussion with the doctor and personal needs. Eating a healthy, balanced diet and following a diabetes meal plan involves the diet lower in sugars and carbohydrates. Checking blood sugar levels several times a day, and getting regular physical activity.
Okay, so how does this affect my body?
Diabetes affects most of your body's systems indirectly, but the three main ones affected are the cardiovascular, nervous, and digestive systems. High glucose levels over time cause blood vessel narrowing due to a buildup in vessel walls and increased fatty substances in the blood. It leads to reduced blood flow and atherosclerosis, or the hardening of blood vessels. Over time, high blood glucose levels and poor circulation harm the heart, the brain, the legs, kidneys, nerves, and skin, and this can lead to various other health problems, such as kidney failure and nerve damage. Due to inadequate blood supply, nerves are damaged or killed, and this leads to loss of sensation in extremities, which is your hands and your feet, impaired bladder function, and altered digestive process. Excessive urination means lost calories, glucose lost, and weight loss. This results in excessive hunger and weight loss. Insulin is responsible for cell breakdown of glucose, so the energy for cells to produce ATP. Without insulin, body breaks down fat cells for energy instead. Proteins are broken down faster than they're synthesized because the body can't properly break down nutrients. This results in an inability to use carbohydrates, and this results in lipidemia and high blood cholesterol levels.
Diabetes type 1 is caused by an autoimmune destruction of insulin-producing beta cells in the pancreas by the T lymphocytes in the immune system, so the body can't produce insulin.
It's caused by genetics and environmental modifiers such as vitamin D deficiency or viruses.
Without insulin and the presence of for transporters, the body cells can't absorb glucose, so they can't perform the negative feedback loop to return to homeostasis.
Major symptoms are excessive urination, hunger and thirst, weight loss, and high blood glucose levels.
It's manageable with insulin injections and diet planning, but it's not curable.
It affects the cardiovascular, nervous, and digestive systems directly.